Philip Rösler has a very polished appearance and the ambition and charisma to go with it. At 36, he's the youngest health minister in post-war German history. His Free Democratic Party have their hopes riding on him. A medical doctor by profession, his task is to succeed where all others have failed and give healthcare policy a major overhaul. The German public healthcare system has been ailing for years. Successive attempts by various governments to patch it up have amounted to little more than Band-Aid solutions, say the critics. The most recent reform created a central health fund and was introduced just a year ago. It intended to make public insurers more competitive and transparent. But now some companies are raising insurance premiums. The very process of collecting the additional money is proving to be bureaucratic and costly. All in all, the public is not amused by the situation.
It's absolute rubbish when you consider all the things they've been throwing about in recent years.
I'm not keen on it, but we won't be able to change it.
Es wird sich nicht ändern lassen. Wir können es nicht ändern.
It's outrageous how they found another way to take in this money.
It's the lobbyists who can sell themselves far better. That's why fewer savings are being made.
But experts are not surprised to see the public having to pay more.
There was bound to be a deficit. They said from the outset that the new model was only to cover 95% of the outlays. Public insurance providers have an extremely diverse clientele and are assigned the money from the Central Health Fund. Insurers who have a lot of old or sick customers will need extra premiums to cover their costs.
The principal underlying problem facing the system is that of rising costs. The long-term consequences of an aging society and advancements in the medical world. There are three areas where the price increases are especially notable: prescriptions, doctors' fees, and hospitals.
The hospitals currently cost public health insurers 55 billion euros a year. Experts say that we could achieve savings of at least 10%, which would mean 5 or 6 billion euros. Prescriptions account for 30 billion, which would translate into 3 or 4 billion.
Philip Rösler is himself no friend of the reform instituted a year ago. He's called the extra premium socially unjust. He's proposing a major revamping of the entire state health insurance system. In Rösler's plan, everyone would pay the same amount, regardless of income. Those who earn less would be subsidized. The opposition are determined to stop the plans.
People don't want a flat rate charge, where a secretary pays the same as an executive. Also, it would require subsidies. It would cost upwards of 30 billion. We're already deep in debt, and there's simply no money.
And the criticism that Philip Rösler can expect from his party's coalition partners is at least as severe.
The Free Democrats' flat charge idea is unfair and unaffordable. All it would mean is the demise of the idea of solidarity in the public health insurance system.
There has to be a balance. There's no way you can pay an extra flat charge of 40 or 50 euros if you're only earning 600 euros a month. These people would need support, and the vast amount of money this would involve isn't available. We need evolution, not a revolution. That said, it is good to see a minister going after bold goals.
Rösler is putting on a brave face, but he has no illusions about his own ambitions and his precarious position, as he revealed in a chat show on German television.
If we fail to move towards a reasonable healthcare system, then I expect I will no longer be health minister.
Philip Rösler needs all the friends he can find at the moment, but while raising the stakes, especially for himself, he is unlikely to see the reforms he wants actually implemented, and he has already conceded that the pace of reform, at least, will have to be more modest.